Hi guys, in this first installment of Benchmark Pep Talks, I've decided to look into the physiotherapy management of frozen shoulder. I hope you find the content in this video helpful. Do follow us on Instagram and Facebook. And in order for ease of viewing, I've decided to break this video into two parts. So the first part will look a bit more into the pathology behind frozen shoulder, the different stages that are involved in frozen shoulder, as well as some of the key features of frozen shoulder. Whereas in the second part, we look a bit more into the different risk factors that may lead to frozen shoulder, as well as the treatment options that are out there for frozen shoulder. Okay, so let's jump straight into the presentation by looking at first what is frozen shoulder. So frozen shoulder is basically a condition where the connective tissue around the shoulder thickens and tightens. So how I like to think about frozen shoulder is having this concept of a dysfunctional sleeve, right? So in the normal shoulder, this sleeve or this layer of connective tissue actually surrounds the arm and shoulder blade, and when it's normal, it's smooth, it's continuous, movement is unrestricted and pain-free. However, when you look at frozen shoulder, what happens to this joint capsule is that adhesions start to form. You have inflammation as well as thickening of the joint capsule, and this can lead to a very dysfunctional sleeve or joint capsule that can create a lot of shoulder pain as well as restriction in shoulder range of motion. If you had, the luxury to do an MRI scan of your shoulder, what you may notice is that it may pick up an area of a thickened joint capsule, especially at the bottom part of the shoulder joint, which could be a sign of frozen shoulder. So now that you have an idea of what frozen shoulder is, I think the next question for us is understand how frozen shoulder progresses over time. And if you look at the different stages, what you notice is that there are three main stages. So there's the freezing stage, the frozen stage, and the thawing stage. And what's important here to appreciate is that while this diagram has indicated a certain timeline for different stages, these stages are often, they are not set in stone timeline-wise. And what I mean here is that for some people, they may have a very short freezing stage and a prolonged frozen stage. And for some people, it may be the other way around. So they may be stuck in that freezing stage for an extended period of time, and they may have a very short frozen stage. So this understanding of the different stages, it provides a guide on what frozen shoulder should be like, but it's definitely not definitive in terms of timeline. And the way I like to think about the different stages is to think, more of maybe a pain dominant stage and a stiffness dominant stage. So in the pain dominant stage, that would be akin to the freezing stage, where there is a lot of pain and inflammation. So here in this graph, you can see that pain is starting to increase over time, and the range is progressively getting more limited. But in that first stage, what you might notice is that your movement is still pretty good. Whereas when you start to move into that frozen stage, what you'll notice is that the shoulder starts to get very stiff and you have very limited range of motion. Whereas in terms of pain, that may start to taper off or even start to reduce over time. So when you have those features, you'll be convinced that you're actually in that frozen stage. And of course, the last stage, which everyone likes, right? For everyone that has frozen shoulder, the thawing stage. So that's where pain starts to reduce and range starts to be restored. And a common question that I get from many people is, if frozen shoulder is going to be progressing over the different stages and it's going to be self-resolving, right, over time, do I still need to seek medical intervention? Do I still need to see a physiotherapist? And the answer to that is yes. Because if you think about it, if you're not moving for 1 to 1.5 years because of pain and stiffness, what you then start to notice is that the shoulder movements start to become very abnormal. You may have very abnormal movement patterns. The shoulder will progressively get more deconditioned over time, so the muscles will start to get weaker, which may lead to other, shoulder muscle problems, shoulder tendon problems, or even neck pain. Therefore, it's important that, if you're experiencing frozen shoulder, please go and seek medical attention. Please go and get the help from a physiotherapist. So we might finish off here by talking about some of the key clinical features of frozen shoulder. So someone going through frozen shoulder may experience diffuse ache around the front of the shoulder joint. There may be pain trying to sleep on the affected side. And what you'll notice also is that there will be this gradual loss of movement in multiple planes. And usually it follows a certain pattern, which technically we call it the capsular pattern. So what that essentially means is that there's this loss of outward rotation first, followed by sideways elevation, followed by inward rotation, and then that forward elevation movement. So it usually follows this pattern, but of course it's not always the case. And in recent years, what some studies have seemed to suggest is that that loss of external rotation is actually quite important in diagnosing frozen shoulder. But of course, we shouldn't be only using one test to form a diagnosis, right? So usually it has to depend on the whole story. So what we picked up in your interview, so the different subjective features, as well as the physical exam. So, do all these features match up to say that, you have there's a high likelihood that you have frozen shoulder. Okay, so I think for today, I might make a pause here. I hope you found today's content helpful. Do drop me comments in the section below if you have any questions about today's content. If not, we'll see you again in part 2 of this video, where we look into some of the risk factors that may lead to frozen shoulder, as well as the treatment options, and of course more specifically, like how physiotherapy can actually help you manage your frozen shoulder.